Penetrating stab wound to the abdomen. You're gonna trauma 1.
Got it.
What happened?
Got jumped in the yard, 3 guys. Why would they do that? All I do is make friends.
We need to transfer him.
Yeah, hold up. Okay, he's ready.
On my count, 1, 2, 3.
Guys, I got a hole in my gut. I ain't going anywhere.
Left lower quadrant looks clean. No major vessels, no bowel.
I can take it. You need to put me under. You do what you gotta do.
No, I think you got lucky on this one, Mr. Wallace. CT admin, then bring him back. We can take care of this one here.
Okay, Doc. I trust you. But I gotta ask, after you're done, am I gonna be able to play the piano? Hey, come on, don't leave me hanging here.
Let me guess. You never could play it before.
I like you, Doc. You can stick your fingers in me anytime you want.
How's he doing?
He'll be fine, though, with a nice-looking scar. Pretty fortunate considering those 3 against 1.
It's actually not the case, Dr. Joy. Seems he stabbed himself, hoping to score a holiday from prison.
What?
I guess when you're up against 30 to life for a double homicide, you look for little diversions.
Hey, Doc. We gotta stop meeting like this, right? Oh, you're giving me the silent treatment, huh? Hey, do you think I could get a TV in here? You and I could watch a little, Family Feud.
Not enough time. Stitching you up, and then you're leaving, which means you won't be needing those.
Ah, come on. Why you gotta be like that?
Because you're not here on vacation.
Hey, give me a break here. I'm injured.
By your own hand, I hear.
You wanna play that game? I am extremely depressed. And you know what? That makes me wanna hurt myself.
Excuse me.
You heard me. You heard me too. I am gonna hurt myself! And we all know what that means.
We have no choice.
I'll call Dr. Charles for a side consult.
That's right, you will.
I'm sorry your stay was not satisfactory.
Satisfactory.
The hell?
Give me a portable chest X-ray stat.
On it.
Doctor's too smart for a stupid con like me.
Lungs are clear.
Doctor?
Come on. Did he swallow anything?
Not that I saw.
Wait, what are those?
They look like little stars.
They must have lacerated his esophagus. Get him up to surgery now.
I guess he got his vacation after all.
Yeah. I just can't believe I let him win.
Really? Does this look like a win to you?
He got what he wanted.
So he's a patient who came here to be treated. That should have been your focus.
Are you saying I should have let him have his way?
You know, my grandfather used to say, never wrestle with a pig. You both get dirty, but the pig likes it.
Since age 13, Henry has been battling anorexia nervosa coupled with borderline personality disorder. Evelyn struggles with schizophrenia, auditory hallucinations, paranoia. We have her on a new antipsychotic, hoping that'll curb her violent tendencies. Patients might be here anywhere from 6 weeks to 6 months.
You're not listening! You don't belong here. Get out! Get out!
That's enough, Tom. Why don't we go work on your art project?
Who are you?
I'm Dr. Reese. I'm visiting from Chicago Med.
He's right. I don't belong here. All the doctors think I'm crazy, but I'm not.
Dr. Reese, we're moving on.
She's the worst.
Just so you know, crazy is a word I never use.
Suicide attempt. 15-year-old female from County Psych. She swallowed bleach, sodium hydroxide, and some sort of rust remover.
Hydrofluoric acid. Okay, call toxicology, get an NG tube in her, push an amp with calcium gluconate, and hang a magnesium drip. Watch for VTAC. You get a psych consult.
Got it. You have to get Dr. Reese for me. I need to talk to her. I wasn't trying to commit suicide. I was trying to see you.
Do you believe it's okay to hurt yourself?
How else could I get to you? It's not like I can ask for a phone call.
Nancy, you could have seriously hurt or even killed yourself.
You have to help me get out of there. They locked me up after I got in a fight with my mom. But she's bipolar, has been for years.
Hey, I'm sorry, but I'm not your psychiatrist.
My mom came at me with a hammer while I was sleeping. I was trying to defend myself. That doesn't make me crazy.
No. If that were the situation, it would be reasonable to defend yourself.
See? You're the only one who said that. All the other doctors think I'm psychotic, but my mom's the one who's crazy.
Dr. Reese, can I speak to you for a second?
I'll be right back.
Could you fill me in? I understand that you ran into Nancy on rounds this morning?
Yes.
Could you have said anything to make her think it was a good idea to come over here and see you?
All I said was crazy isn't a word I ever use.
Huh. Gotta be very careful the way we talk to younger psych patients. They're much more vulnerable to mixed messages. She seems to think that you're some sort of ally.
I am. Aren't we all?
To get her the right treatment, of course, but this is a young woman who purposefully drank extremely toxic chemicals. I mean, Nancy's been diagnosed with borderline personality disorder. She has severe bouts of manic depression.
Uncontrollable hysteria, paranoid delusions.
People who suffer from these disorders can be very persuasive, very manipulative, and a danger to themselves. So we have to be careful. We wouldn't want to put her in a position where she wanted to harm herself again.
Hey, Sarah. You got a second? I heard that, most of the psych residents get therapy.
Yeah.
Have you tried it?
Uh-huh. I'm sorry. Can we talk later?
Sure. Yeah.
How's she doing?
Well, we flushed her pretty good. She'll be medically cleared soon, and we'll have to go back to the psych hospital. You buy her story?
I don't know. She's on a 6-month psych hold. Does she seem like she requires that much time locked up?
Don't ask me. Psych's way too spongy. In med school, my head shrink professor took us to the mall and asked us to point out people we thought were mentally ill. No one could agree. That is when I knew I wanted to be an ED doc. Much clearer business.
Yeah. I wish there was a way to evaluate Nancy like an ED doc.
Well, maybe there is. Like I tell my residents, always go back to the history.
Dr. Charles, do you have a minute?
I do.
In order to get a more complete history, I contacted the officer who arrested Nancy and her mother. He sent me his report. Said they often get called to Nancy's house on domestic disputes involving the mother. She's been in and out of jail for assault. In fact, she is at county right now. Please take a look.
This could just mean that, mental illness runs in Nancy's family and she and her mom suffer from the same disorder.
Or it could mean that Nancy was wrongfully committed by an unstable mother. The one thing we know for sure, it was her mother's testimony that got Nancy committed, and her mother's an unreliable witness.
Sarah, they're telling me to get dressed. They're sending me back.
I know. I'm sorry.
Sarah, please, help me.
I tried. I did, but Dr. Baker has conservatorship over you. According to the courts, she has to be the one to change the diagnosis, and we couldn't change her mind. Hey. I'm not giving up, and you can't either. Stay strong. We'll figure something else out. Okay? Give me a second. Dr. Charles? I know I don't have any definitive proof, but she is sane. I know it. We can't let her go back.
Slow down, Dr. Reese.
Dr. Baker just doesn't want to admit that she misdiagnosed her.
You know what? I happen to agree with you. I'm filing an appeal.
You don't think she's mentally ill?
Can't be positive, but either way, she should not be locked up on a long-term hold based solely on her mother's testimony.
Need some help?
Treatment 1.
What happened?
Give me some pressure. Must have grabbed the scalpel from the cart. Tourniquet her arm, giving hemostat.
It's tied?
I'm not crazy, Sarah. I'm not.
It's my fault.
Why'd you say that?
I gave her false hope. I told her I believed she was stable when she clearly isn't.
Well, not sure I agree. I mean, just made her case a little tougher, but I'm still gonna file the appeal.
Why would you do that when she just tried to kill herself?
Losing hope is not a sign of mental illness. It's a sign of being human. I mean, the poor girl, she has a violent, unstable mother, and her fate is in the hands of a psychiatrist who doesn't believe a word she says. I mean, given those odds, I can absolutely understand why she'd fall into despair.
You're going to trauma 1.
18-year-old male, GCS 12, tackies to 130, suspected DUI, parked his Beamer in someone's living room, broke the gas line, started a fire.
Okay. Dr. Rhodes, you got this?
Got it.
Thank you.
X-ray.
Talk to me.
GCS 6, BP 120/80, King Airway in the field.
All right, Dr. Choi, Dr. Reese, now. You're going to trauma 2.
He's hypoxic and inhaled a lot of smoke.
All right, rotate.
I pulled the driver, the kid from the wreckage.
Yeah.
My partner insisted on clearing the house.
Jaw trauma labs, an ABG, and a carboxyhemoglobin. On my count.
Thank you, officer.
1, 2, 3. I'll take over.
I start a saline line. Let's get him set up.
Tough to bag him. He's pretty spasmed down. I need suction. 20 Vatomidate, 100 of sucks now. We need a better airway.
On it. Prepping sucks. Watch his BP. Heart rate's still tacky.
Bilateral pubic rami fractures on the X-ray. Let's fast him.
Pressure's dropping.
There's free fluid in his belly. Possible pelvic hematoma. All right, let's get him up to the OR now. Start 2 units of rapid transfuser. Put trauma and angio on standby. Let's go.
Oh, hold on. He's not going anywhere till I get a DUI blood draw. We're charging him.
His belly is shredded. If I don't operate right now, you're not going to have anybody to charge.
You already have him on IV fluids. I got 10 minutes at best to get an accurate blood alcohol level. You take him to the OR, it'll be too late.
The officer wants to do a draw to test your blood alcohol content. Do I have your consent?
No.
There's your answer.
State law says I don't need consent.
Hospital policy says you do.
You need to stop.
Move.
Hey, My partner could have died back there. You step aside.
This is a hospital. Our priority is to treat patients, not to make arrests. As soon as he's out of surgery and awake, he's all yours.
Get me that blood or you're under arrest.
What charge?
Obstructing a police investigation. You're being ridiculous.
Get me that blood.
Do what you have to do.
Maggie.
Take the phone.
You don't have to do this.
Stay back.
Chicago Med has a strict policy against forcible blood draws.
I got that. Maggie might have been following hospital procedure, but from Patrol's point of view, she obstructed a time-sensitive investigation.
And if we had delayed that operation, we could have put that boy's life in jeopardy.
Did you come here to argue or ask a favor? Listen, Wyndham told me that kid was doing close to 80 in a 25 zone. And that house he hid, there was a family inside. If they can't get DUI charges to stick, that kid is gonna post and be back behind the wheel in a couple of days. They're not happy.
And you think I'm happy that one of my people is sitting behind bars?
Sharon, you overestimate my point.
Hank, it's Maggie that's in there. And I'm asking you as a friend, find a way to get her out.
Look, they're not gonna release her until after she's been processed and arraigned. I'll see if I can have her moved up on the docket, but other than that, there's nothing I can do.
Can I at least see her? Maggie? Sharon. Girl, I am so sorry.
Hey, you got 5 minutes. So I guess you're not here to take me home.
Not yet. Voight said they can't release you until you've been arraigned.
They're actually gonna charge me for this?
Kilwait's got the gloves off. We've got a good chance of getting the charges dropped or at least reduced.
No, I was doing my job.
You handled the situation exactly as I would have. That blood draw would have left the hospital open for litigation.
Yeah. When I stopped to fill out a credit application, that's what I'll tell them when they ask me, have you ever been arrested?
Maggie, we're gonna get you through this.
You better. So what's the story? Sharon didn't need to send a trauma surgeon to come and pick me up.
I wanted to do it. Felt bad.
Why? Because I'm the one who got busted? Listen, I know you think that because you're a trauma surgeon, you're the boss. But the ED's mine. And nothing happens in my kingdom that I don't take responsibility for.
You're right. You're right. Maybe. System's rigged. It pisses me off.
Pisses you off.
I have sat in jail. My buddy and I, summer before I went to college, we got busted trying to buy drugs off of an undercover cop.
You?
Yeah. I mean, come on, at that age, you think you're invincible, right? Turns out, only one of us was right. My dad pulled some strings, and he got me off.
What about your friend?
Well, his dad didn't own a department store. Turns out the lifeboat was only big enough for one of us, so I had a choice. I could stand by my friend, or I could jump in. So I jumped in the boat.
Fred?
Dr. Charles.
Hey, Doc, how's it going?
What's up, Conway? How's the baby?
Still not sleeping through the night.
You ever try chamomile tabs? You can get them at any health food store.
Thanks for the tip, Doc.
Hey, Dr. Charles.
Dr. Reese, this is Officer Kowalski. He will be our escort for the day.
Hi.
First time? You'll be fine. Just don't feed the animals. Sign a visitor waiver, please.
Waiver?
Basically says that if we get taken hostage, that the state won't negotiate our release. Just standard procedure. Hey, look. Your determination to explore exposure therapy, it's nothing less than admirable. But it doesn't mean we have to do it here. So if you're having second thoughts, now would be the time to tell me. You're absolutely sure you want to do this?
Yes. This is what I want.
So, Hector Ramirez, anxiety, depression, history of intermittent explosive disorder.
All clear, Doc.
Dr. Reese, I really do.
Dr. Charles?
Hello, Mr. Ramirez. I'm Dr. Reese.
Dosage?
Right. How have you been feeling since Dr. Charles altered your dosage?
Knock it off, Ramirez.
Gotta take a little break.
Let's get Ramirez back to his cell.
Look at me, look at me. Take a deep breath. Take a deep breath, it'll pass, okay? It'll pass. Okay, we need to take a little break.
Get Ramirez back in his cell.
Please escort Dr. Reese back outside. It's okay. I'll be there in a bit. It's all right. You shouldn't feel bad.
Why not? I am the one who asked for this. It was stupid.
Not stupid. Ambitious.
I have no business trying to treat a patient like that. I can't help him or myself.
You know, the irony is, that guy's so much more scared of you than you are of him.
I doubt that.
What, are you kidding me? A guy like Hector, not gonna let you in, a shrink? He's utterly terrified of what you might find, you know, what he might have to face, you know, so he does a jailhouse thing.
What do you mean?
Convicts survive by demonstrating dominance, by going straight to attack mode. That's how they do it.
So he manipulated me.
These guys are experts at spotting vulnerability, you know? And Mr. Ramirez exploited yours.
And so he got the response he was hoping for. I want to go back in. I apologize for ending our session prematurely. If you don't mind, I would like to continue. May we proceed? Here to help you, mister, but I can't do that if you keep barking at me. Now, how's your new dosage of sertraline working out? Any drowsiness or changes in appetite? How about nausea, diarrhea, problem sleeping?
Feels I'm gonna puke sometimes.
Okay. Okay, I can prescribe a medication called Zofran for that.